Hey there. We are here to talk about the correlation between ACE and frequent headaches in adulthood. The study that we read was about a population that was derived from patients who were getting comprehensive physical exams, and then they were sent an evaluation about the ACE, and the statistics were gained from those results. So in the results, the prevalence of headaches, the frequent headaches in the adult population, in our study population, was 16.6%. It was found to be more common in younger age women or younger age individuals, women, and people with lower educational attainment. In the results, it was found that there was, with an increase in ACE score, there was an increased prevalence of frequent headaches in adulthoods, and then they actually found a correlation between a dose-response relationship between stress. The more stress, the higher the ACE, the higher incidence of the frequent headaches. And it was actually, if you had an ACE score of greater than or equal to 5, you were 2.1 times likely to develop the frequent headaches in adulthood. So that is what that study resulted in, and here are our strategies.
Yeah, so now that we know that lovely information, what are we going to do about it? Well, since we can't go back in time and, kind of fix some bad childhood experiences, we have to deal with what we can in the present. And based on that kind of dose relationship that Abby was talking about, kind of one of the best things you can do is just stress management. Eat well, exercise, try to find little uplifts throughout your day to kind of break up some of the more stressful things. So basically, by decreasing stress, you can lead to decreased headaches. Sometimes, depending on what your stressors are, you'll need things like social work and, financial stuff for that. And then another thing was maybe diagnosing the type of headache. So in this study, their measure of frequent headaches was the simple question, are you troubled by frequent headaches? There's nothing about how frequently do you have headaches, what's the character of your pain, do you have visual symptoms, anything like that. The study didn't go into any of that. So perhaps if you actually had patients with some of these risk factors from an ACE standpoint, and then, we're a little more thorough and trying to figure out what type of headache they have, then you can do an intervention based on that headache. So those would be the 2 strategies we recommend.
And nope out.